Happy late New Year and happy Lunar New Year, everyone. I'm Jonathan Wang, the founder of the Youth Advocates for Global Health Association. Welcome back to our first webinar of 2025.
And my name is Matthew Yu, the Vice President of the organization. Today we're excited to explore the critical topic of mental health and wellness in family medical practice. This subject is more relevant than ever as we continue to navigate the complexities of healthcare in our rapidly changing world.
Today, we're delighted to have with us an expert in family medicine, Dr. Walter K. Chow. Dr. Chow has been practicing in Victoria, BC for over 2 years, 2 decades, and is renowned for his expertise, diligence, and compassionate approach to patient care. His extensive experience in family medicine gives him unique insights into the intersection of mental health and primary care.
Throughout his career, Dr. Chow has demonstrated a deep understanding of the importance of mental health and overall wellness. His approach to family medicine integrates both physical and mental health aspects, making him an ideal speaker for today's topic. Dr. Chow's commitment to providing comprehensive, patient centered care has earned him a reputation as a knowledgeable and caring physician.
Following the presentation, we will have a Q&A period where all participants may submit their questions using the chat function. But without further ado, let's give a warm welcome to Dr. Chow. Thank you so much for joining us today.
Thank you so much, Jonathan and Matthew, for the kind introduction. I met Jonathan when I was speaking at a family practice conference in Vancouver a few months ago, and he asked if I would take part in this program, and I was delighted to do so. It's so nice to see motivated, knowledgeable, affable young people that want to make the world a better place, and I think they're definitely on the right track for that. As Jonathan was kind of introduced me, my name is Walter Chow. I'm a family physician in Victoria for 30 years now, or a little over 30 years. And before this, I was a pharmacist and decided to further my career and do medicine afterwards. I've been doing a family medicine here, and that involves an array of looking after multiple morbidities in practice. But today we decided to focus on mental health practice in primary care. And within mental health, you can appreciate there are many different mental health elements, but what takes up the vast majority of what we do in primary care is the management of depression and anxiety disorders. So I'll focus on those two topics. Dr. David Chisholm was the first director of the World Health Organization. He's a psychiatrist, and he shepherded the notion that mental and physical health are intimately linked. I'll say that again. Physical and mental health are intimately linked. You can't have one without the other. And certainly, as I go through the slides I'm going to present today, you'll see how much that is true. And he coined the concept by saying, without mental health, there can be no true physical health. And I think that is so true in family medicine. We see people obviously with physical ailments that affect their mental health. But conversely, we also see many people with mental health issues that affect their physical health. So the two are intimately related. And unfortunately, part of it is because of the way society feels about mental health. Often it takes a back seat to the physical ailments. But I think as we go through this, you will see that really the two are intimately connected. And when we treat one physical ailment, we always have to consider the mental health outcomes of that illness. And conversely, when we see mental health illness, we always have to think about the physical outcomes.
Yeah, I really think because we often try to like box mental health and physical health as two completely just separate things, but I think
Yep.
they are truly really interconnected, and one really does affect the other.
The association between mental health and physical health is intimately related. This little pie chart was taken looking at non-communicable diseases causing disability-adjusted life years. So what that means is if we exclude infection as a cause, what are the other ailments and how does it affect people to be disabled and how many years of their life are they disabled? So if you look down here on the green part, can you see my pointer, Matthew, when I point down here?
You're
Not visible. Yeah. Bottom left corner of the pie chart says cardiovascular disease 20 2%. So a lot of the time we spend managing cardiovascular disease. This is high blood pressure, high cholesterol, stroke, heart attack, obesity. And you can see that makes up a big part of what we do. Then we go down to some other things like respiratory illnesses. This is mainly asthma type illnesses, chronic obstructive pulmonary disease. Remember, we're excluding respiratory tract infections and illnesses like pneumonia because they're infectious in origin. Digestive disease disorders make up a big part of it. And then you can see in the bottom right-hand side of the bottom of the chart, cancers make up what, about 11% of disability years. But look over at the orange part of the pie chart, almost 30% causing disability worldwide adjusted are psychiatric or neuropsychiatric disorders. And a big part of that is this unipolar affective disorder. By that, I'm talking about depression and anxiety disorders. So really, neuropsychiatric disorders make up a bigger part than all of cardiovascular causes, all of cancers. So that's how important it is in terms of management and the time that we spend trying to fix the problems so people live better lives, both in terms of quantity and quality of life. Among the mental health illnesses, major depressive disorders are a big part of it and have a big prevalence and impact. And in Canada, if you look at that 1 year history, then 12 in any 12-month period, almost 5% of the population is suffering from a depressive disorder. And if you look over in terms of a lifetime risk, it's over 12%. And as we've already talked about, there's a big association between mental and physical impairment. Both of these cause poor quality of life. And even, I think, as importantly, it causes mortality differences. So this is mortality in self, obviously, with somebody with a mental health illness that would end their own life by self-harm. But think about all the flow down. If you have mental health illness, you're not going to have the incentive to go and do exercise. You might not have the incentive to go and eat a proper diet. Many people with mental health illnesses smoke more, they drink more alcohol. And of course, in their social relationships, they can be tremendously destructive and cause a lot of stress. And more we're recognizing the downside of the amount of stress in terms of causing harm to physical health. So how common are mood and anxiety disorders? We'll focus it down to British Columbia, where we live. And this is the percentage of the population with disorders in the last year. In major depressive orders, almost 5%, social anxiety disorders, almost 5%, and then panic disorders, which you can think of as a severe manifestation of an anxiety disorder where it actually causes panic. Now, these statistics are quite a few years old, and I would, without reservation, say in the last 10 years, that it has become a lot worse. I think the world that we live in, even before COVID, it was a lot more stressful. We have changes like global warming, we have political and geographical things that have caused a lot of worry. We have economic situations where younger people, especially, coming out saying, well, where am I going to be able to afford an education? If I have an education, is it going to translate into a job? Housing prices have gone through the roof, of course. So all of these things create a tremendous amount of stressors. So I would guess today, if we could remeasure depressive disorders, social anxiety disorders, it would be much higher than that. And this applies, certainly right across the spectrum of age. Young people have their stressors and their reasons to feel depressed. And of course, older people have their separate reasons for feeling that way. But suffice to say that this is a very, very common disorder that we deal with in medicine. Family medical care, we look after the bulk of people with mental health disorders, and we wish there were enough psychiatrists, psychiatric services to help all of these people. But it's estimated that we look after the bulk of it. And 92% of patients, it's estimated, that receive medical treatment for depression in BC are only managed by a family doctor. In other words, there's no psychiatrist involved. Fortunately, the pandemic brought some of this to light, is that now we consider primary care not only provided by pharmacists or by physicians, I'm sorry, but nurse practitioners, pharmacists, community healthcare providers, and hopefully that will help bridge some of the care gaps. There's a tremendous shortage of psychiatrists in every community, including well-serviced communities like Victoria and Vancouver. But really, to see a psychiatrist, you have to have a mental health disorder that is the worst of the worst. And there are not very many psychiatrists that are able to provide ongoing care. So usually they will help make a diagnosis, help guide therapy, then is put back into the hands of a primary care provider to look after the rest of it. What are the challenges, in treating depression and, major depressive disorders? A lot of it still goes untreated, and there's a multitude of reasons, but let me highlight a few of these for you. Of all the patients with mental health disorders in the last 12 months, it's estimated that 50% of them don't receive any type of treatment at all. And half of them receive some treatment, but only a small portion of those are considered to be adequate treatment. In other words, they get some response, but not to the point where they're back to feeling and functioning normally. And it's estimated only a quarter or less than a quarter of patients receive total adequate treatment for their mental health disorders. This falls way behind in terms of other things we deal with on a day-to-day basis. We see people with high blood pressure, high cholesterol, high blood sugars, and I think we're doing a pretty good job of diagnosing and managing those disorders to the point where we say, yep, we consider these patients adequately controlled. Mental health disorders, not so much that we can brag about that. But I don't want to leave you in the new year feeling doom and gloom over this topic. So I want to share a little bit of the mental health initiatives that have been implemented on an ongoing basis to try to make sure that everybody gets adequate mental care. One of the challenges in diagnosing mental health disorders, depression, and anxiety is that it's difficult to make the diagnosis. If I was making a diagnosis of high blood pressure, I would put a blood pressure cuff on your arm. I would do the measurements and say, look, your numbers are above where they should be. Therefore, you have a diagnosis of high blood pressure. If I was diagnosing diabetes, I would order a blood test, or high cholesterol. I would order a blood test and say, your numbers are above the levels we can define these illnesses. But nobody has been smart enough yet to devise a way to be able to scan the brain, to get surrogate markers with a blood test to say you have a chemical imbalance in the brain that is accounting for you to feel this way. So part of it is trying to make that diagnosis. Society is better and better, I think, at accepting a mental health diagnosis. I think, 30 years ago, even when I started practice, to have a mental health disorder was kind of taboo. Much rather say, well, I have high blood pressure, I have high cholesterol. But boy, if you say I have depression, I'm not willing to accept that diagnosis. And there's also a cultural difference too. In many cultures, mental health disorders is not nearly as accepted as it is becoming in Western society. So a lot of work to be done even on a cultural basis. The second thing in terms of a diagnosis is frequently there's a comorbidity between physical and mental ailments. So I always tell patients that the brain is like the computer system. It's the software that runs the entire body. And when it's malfunctioning, it can cause physical symptoms. For example, the patients that come in with chronic headaches, the patient that comes in with, I have difficulty swallowing, I have difficulty breathing, I have disturbances in my gut. All of these things can be manifestations of psychiatric disorders, but manifesting in a physical way. You don't have to be a doctor when somebody comes in and says, I'm feeling anxious, doctor, I'm feeling depressed. But not all patients present that way. In fact, often they don't. They come in with physical symptoms. So the challenge in family medicine is that we try to uh, do the due diligence to rule out all the disorders that physically can cause these things, but also integrate the possibility that this is a mental health disorder that's causing the physical symptoms. Poor adherence to treatment, I'm going to come back to in a moment. There's always been difficulty with keeping track of relevant information because patients that come in family medicine often have a list of different ailments, how to keep track of all of these. And I think, the advent of electronic medical records and technology certainly does help us manage those things a little bit better. And then following patients in a proactive rather than a reactive manner. We save patients in the office for mental health disorders often when there's a crisis situation that has developed. But what we want to do is be more proactive, tell patients how they guard their mental health against stressors, against the other things that can affect their mental health. And these, they're very simple to say, but very difficult to do. So making sure that patients get enough sleep and good quality sleep, making sure that they exercise on a regular basis. 30 minutes of exercise 5 days a week reduces very significantly the incidence of mental health disorders, even things like dementia. It will reduce the incidence of that. Managing stressors. The world is stressful. And if we learn the skills like mindfulness therapy, cognitive behavioral therapy techniques, then when these stressors come upon us, then we know how to manage them rather than letting it affect our mental health and in many times our physical health also. And then the healthcare system, we are stretched very, very thin. And even within the healthcare system, recognizing that mental health issues are important, they often take a back seat to the other diagnoses that we manage. So, for example, if you have a cancer, if you have a heart condition, those things go to the top of the chart. Mental health disorders often take a back seat, a poor cousin approach in terms of diagnosis and management. And then I think part of it is, the inadequate reimbursement for the time, the intensity, the complexity of managing mental health disorders. So, for example, if you have high blood pressure, you come in, I measure the blood pressure, I talk about the foundations of managing blood pressure, like lifestyle changes. We talk about medications, the importance of adherence to medications. That you can see is a relatively simple diagnostic and treatment algorithm to go through. But if you came in and you've lost your job and your family has left you and you're addicted to alcohol or recreational drug use, that's a much longer visit. That falls in the realm of mental health disorders. And the reason why I think sometimes that it's not given the attention it is saying, that's really hard work and I just don't have enough time or not compensated for the time that I spend for dealing with those disorders. What can help? I talked earlier about, well, I don't have a blood pressure cuff. I don't have a blood test that I can do to diagnose this disorders. There are recognized validated rating scales, one called the PHQ-9, and this is a series of questions that patients answer. It's not used for diagnosis, but it can be used as a screening tool to see what the suspicion of a disorder that falls in the realm of a depression type of disorder. So answer these questions, it's scored, and then you add up the score and it gives you the likelihood. I find it very, very useful because also then I have a number to show the patient saying, you have a score of 12 out of 30. And it says right here, if you score over 10, you have a moderate degree of depression. And when they look at that number, sometimes they will believe that or enforce what I am telling them by looking at that number. We have the GAF, Global Assessment of Function. We have things like the Sheehan Disability Scale to not only say, you have a mental health disorder, but how is it affecting how you function in life? We have other tools like the audit, which is used to very simple few questions you answer to tell us if you have an alcohol use disorder. And then very often used is the MDQ, which is another depression type of scoring system. So these things have been very helpful in bringing mental health, the diagnosis, into the realm of physical medicine, where we have physical measurements like an X-ray, like a CT scan, like a blood test, like a cardiogram, to say, yeah, we can measure the likelihood of having these things. So we have diagnostic things that can be helpful in terms of these rating scales. Practice management tools, we have algorithms to say this is first line therapy, this is second line therapy, this is third line therapy in terms of medication. So these practice management tools can be very helpful. And then, I think the whole BC Mental Health Initiative has put a lot of resources into helping people with mental health disorders. I think one of the big changes that has been really helpful is self-help resources. Not everybody have access to a psychologist, to a psychiatrist, but there are some apps, on phones. There are some virtual programs where people can enroll in and really get really good mental health advice and lifestyle management for managing their mental health disorder. I showed you a couple of slides back that compliance is one of the issues. And this graph looks at patients continuing therapy, their percentage of patients that continue therapy when they have a diagnosis of the things you can see on the right side of the page. And this is looking at time zero when we make the diagnosis and prescribe treatment versus a year down the road. And depression is highlighted in this sort of pale greenish color. You can see that if I make a diagnosis of depression and the patient is on board and is going to take therapy, if I do nothing in between in terms of seeing them, say, here's medication for a year, I'll start taking it and you will feel better. At the end of 1 year, less than 50% of people are still taking that medication. So it takes a lot of reinforcement for a multitude of reasons. I'll highlight a couple of those for you, but that's really not unique to mental health. But you can see across the spectrum of ailments, compliance with medications is always a big issue. Something is only going to work if we can convince a patient to take it. So, there's timelines that we know in treatment of any disorder. A couple of weeks after therapy is started is a time when patients might say, I'm not sure I want to take this or I have side effects. I'm going to stop taking treatment. So that's a critical time to try to reinforce compliance. There's a second point, sort of 2 months, 1.5, 2 months down the road when patients treated with mental health disorders start to feel better. And when they start to feel better, they say, I don't think I need this medication anymore. I really don't like to take medications, so I'm going to stop taking it. Far too soon, we know that the minimum treatment period when we use pharmacological intervention has to be a year. And depending on the circumstances, the history of how many times it's occurred, how severe it is, it can go on for much longer than a year and sometimes forever. And then during maintenance that we talked about, after 4 to 6 months, patients might not be willing to put up with side effects, might not be willing to put up with the cost of medication, the stigma of being on a medication. So these are critical touch points when, as chronic care providers, we can have interaction with the patient, say, it's fantastic that you're starting to feel better, your life is starting to come together, but I haven't cured you of your anxiety disorder. I haven't cured you of your depression. I've started to make you feel better. It's really important to continue on with this medication and the non-pharmacological therapies. We should be treating mental health disorders like we do other chronic illnesses, like diabetes, like high blood pressure, like high cholesterol. Very rarely do we cure people of those conditions. We control the condition to reduce the outcomes of their illness, but we don't actually cure them. So again, we have to treat this like a disorder where we're controlling it and they need to stay on therapy in order to keep things better. There's been a number of community-based initiatives. So we have family practices that are supported by mental health treatment groups, addiction, and I'm going to come back to addictions for a moment. We have to be acknowledged for the time it takes to look after these patients, and we have to integrate in other allied healthcare professionals. So pharmacist comes to mind. If I prescribe a medication for a patient, the pharmacist dispenses a 3 month supply, let's say. The pharmacist knows and should know when that patient's not coming back for their repeats for the next 3 months. And we're trying to offload some of the responsibility to say, I don't always have time to call up the patient and say, you're due for your refills or you're taking your medications, but the pharmacist, maybe we can have help do that. We can have a nurse practitioner or a physician assistant come and help us do some of those tasks to make sure patients stay on board with their treatment plan. So I think all these community-based, multifaceted healthcare professionals will really help with better outcomes. So, we really need, when patients fall down from a mental health perspective, we need somebody pulling, we need some help pushing. But the outcome, I think, is that one patient at a time, we get them to overcome the hurdles of mental health. And once again, to reiterate that very famous saying, there is no health without mental health. So, a lot of work to be done. A lot has been done, and I'm very hopeful for the future that more can be done. I want to bring back, as I mentioned a moment ago, about addiction. I see in my practice over the last several decades a terrible thing that is developing, and that is the amount of mental health issues in our society related to substance abuse. Alcohol, interestingly, the recent guidelines have come out with alcohol consumption where um, it's said that no amount of alcohol we consider medically safe, whereas 10 years ago we say, one or two drinks a day for social reasons. We accept that as being medically safe. Now it's basically no amount of alcohol we consider medically safe. I don't think it's realistic. It's part of our culture. It's part of enjoyment of life. So I tell my patients, we cannot endorse any amount of alcohol use. Light alcohol use is part of our culture. The messaging is less is better. And the people that I talk to in the service industry and restaurants and stuff saying they have noticed a significant reduction in the amount of alcohol that is consumed. And you see on most restaurant menus, bar menus now, they have mocktails or non-alcoholic alternatives to alcoholic beverages. So I think society is moving in a right direction in that regard. Unfortunately, the use of marijuana and the legalization of marijuana, I think, has been very destructive. And especially when you're talking to youth groups, the last thing we need in youth group is a motivation. And that is one of the effects or one of the side effects of cannabis use is it reduces motivation. And for people genetically predisposed to it, it's been documented over and over again. If you're genetically predisposed, a single exposure to cannabis can bring on schizophrenia. The frontal lobe of the developing brain does not mature until about the age of 25 years old. And when alcohol, nobody waits until the age of legal alcohol consumption. I think the same thing has happened with cannabis. So when they legalize it, they say, yeah, we will legalize it for people over the age of 25 that want to use it recreationally, but it doesn't happen. Many young people right down to the age of barely teens are using cannabis on a regular basis with great detriment. So I think that's been one of the really bad political decisions that have been made in the last decade is legalization of marijuana. Unfortunately, we're living with the consequences of that with physical, mental health issues and social health issues related to that. So I think that hopefully, in that very brief slide presentation, I've given you sort of a global perspective about the issues of the importance of treating mental health. In addition to physical health, should not pay any less attention to it. Should do everything we can to have good functioning mental health so that we can physically and mentally thrive. Matthew, Jonathan, I am very happy to take on any questions that your audience may have.
Yeah, thank you so much for that amazing presentation. We really learned so much about all the different points of view about mental health. I did just want to ask about something you did say at the end of the presentation regarding alcohol and marijuana. Is
Mhm.
it that like alcohol and marijuana causes more depression, or is it more depressed people are more likely to resort to marijuana and alcohol as a way to sort of escape their situation? So, like,
Yeah.
is it kind of both? Like, how does the
Mm.
correlation or causation play into account there?
Yeah, I think it's a very good question, Matthew, and it goes back to the old question: the chicken come first or did the egg come first?
Mm.
I think it's multifactorial. We have people that start to feel depressed, and as a result of that, they drink alcohol to escape the feeling of depression. But alcohol is a depressant. So while they're under the influence of alcohol, they may feel happy, they may feel ebullient, they may party and do a lot more things. But the bottom line is on top of their depression, they're creating another illness. Antidepressants in combinations with alcohol can be a very dangerous combination. So sometimes we're left with a situation where somebody has an alcohol dependency. We say, we can't use the antidepressants that we want to in the doses that we want to without getting you off alcohol first. And it's the same with marijuana. I think people can drink, start using marijuana in a very innocent way. And then as a result of sociological factors that relate to it, with result of brain chemistries related, develop a depression. So very often it's hard to tease out the difference between the two. Suffice to say, if there's an alcohol or substance use disorder on top of a mental health disorder, it becomes much more difficult to treat.
Yeah. Yeah, that was a really great question by Matthew. This legalization of drugs and the overuse of depressants is really a huge issue. In recent years, the destigmatization of poor mental health has been a big thing in North America. And I'm not quite sure if that's probably not the case in other parts of the world, I've noticed. And it is quite surprising how bad mental health can lead to overall worse health. Do you
Mhm.
think, how do you think mental health problems start in the first place, and how can we prevent them?
Yeah. I think it's nature and nurture, both of those, Jonathan. So we certainly see people that have depressive illness. And when you go back generationally, their mom was depressed, their dad was depressed. That sets them up biochemically to have a 50% chance of having a depression. They know this from twinning studies where they have two twins, identical twins that were born separated at birth. One is raised in a ideal environment, family environment, that would be conducive to good physical and mental health. Another one is raised without those benefits. And we know that in both groups, they end up with a much higher incidence of depressive illness. So I think it's part nature, it's part nurture, in terms of developing the illnesses. We unfortunately don't have the same resources for everybody to say get good sleep, get eat a regular diet, exercise on a regular basis. And those things are very conducive to good physical health, but also very conducive to mental health. It's very hard sometimes to live in somebody else's shoes to know what they've been through. So, my practice in Victoria, even the beautiful city of Victoria, is in a part of town where there's a lot of street people, homeless people. And it's fascinating sometimes when I come to work in the morning, if I have time, there's somebody that has set up an overnight shelter in my parking space to say, "So, what's your story? How did you end up here?" And it's very interesting, when you listen to the story of some of these people saying, "If I were in those circumstances, I would be at least as bad off as you are." So, you have to be sympathetic to recognize that people don't choose mental health disorder. They come by it through genetics, they come through it by sociological circumstances, and we need to treat them with equally the same respect that we did with somebody that says, you have diabetes. Your mom and dad had diabetes, so you have a 50% chance you have diabetes, versus the person that said, you have no family history of diabetes, but you've been drinking a can of Coke and eating a Mars bar, for the last 10 years. No wonder you have diabetes. So I think we need to treat the illness and understand the circumstances that maybe led people to that outcome.
Yeah, definitely. I did just want to talk more about maybe the causes of depression a bit more. How do you think, or like, what do you think are some maybe overlooked environmental or social factors that could contribute to people developing depression?
Yeah, thank you. I'm just going to hold that thought for a moment because I didn't answer the other part of Jonathan's question, which I think is very
Oh,
important.
yeah,
Talking about societal differences, and I think in North American society now, it is more accepted compared with even 30 years ago that you have a mental health diagnosis of depression, more so anxiety. And in fact, in some cultures, for example, in Japanese culture, to be anxious and to say you worked yourself to the ground is almost a badge of honor. You stayed at the office far longer than anybody else did. You have neglected your family, you've neglected your own health, so you get a badge of honor for doing that. There are big differences in society in South Asian and East Asian culture, unfortunately, is not nearly as accepted to get a mental health diagnosis. And they would much rather have a physical diagnosis. And very often, especially in South Asian and to some degree in the East Asian culture, manifestations are also often physical symptoms. So the fatigue, the headache, the chest pain, the shortness of breath, the gut disturbances, very often are physical manifestations of mental health disorders. Much less common for South Asian, East Asian patient to come in saying, "I'm feeling really stressed. I'm feeling depressed." You know, so we have to understand that there are cultural differences in manifestation, big cultural differences in accepting the diagnosis. And remember one Asian patient, Chinese Asian patient, described to me that when a young person is going to be married to their spouse, they go back 3 generations in the history of that prospective spouse, checking for mental health disorders. They can have high blood pressure in the family. They can have diabetes in the family. They can have cancer in the family. None of those would preclude the endorsement for that couple to get married. But if there's a mental health diagnosis, then there would be great objection to that person marrying into a family that has mental health disorder. So that's how much it's shunned. So in my Asian patients, I have to take a great deal of care in explaining to them that the brain malfunctioning is no different than their heart or their lungs or their gut malfunctioning. And we now understand what causes mental health disorders. In Asian culture, of course, herbs and berries and holistic types of treatments are often used for treating a variety of ailments. I don't know that they have really powerful drugs like we do in Western medicine for treating mental health disorders. So part of the fear of mental health disorders is because of lack of treatment. If you were seriously mentally ill, institutionalization was the treatment and not proper medical care. So sorry, I just wanted to get back to that, Jonathan, because that's such an important part. Matthew, I have a attention deficit disorder, so you have to repeat your question so I can get to it after that.
All good. No, I think the culture part is an extremely important part to talk about. I think
Yeah,
it's so stigmatized, especially in a lot of Asian and South Asian countries.
yeah,
You're often like, it's very competitive there, and you're letting your family down, you're letting other people down when you talk about mental health issues. So a lot of
yeah.
people go undiagnosed or they suffer silently with mental health issues. So hopefully, like society can progress in those areas and more knowledge about mental health can be introduced to prevent it. Um, and speaking of a lot of like causes of mental health in the first
Mm,
place, I did just want to ask if you've noticed any sort of um, social or environmental factors that often lead to depression that may be overlooked by many people.
mhm, mhm. Yeah, I think stress is a big causally related factor to depression and anxiety disorders. And I think the world for everybody is more stressful now. And I really do sympathize with young people, trying to get established in life, the stressors they have to overcome. To give you an idea of how the world has changed, when I applied for university to get into pharmacy school and subsequently to get into medical schools, UBC, the grades required to get into the science program there was 70%, 7-0. Now you would not get into university. You would certainly have no hope of getting into pharmacy school. You wouldn't even dream of getting into medical school with those types of grades. We have more people. We have more people competing for a limited number of spots. So that alone, can tell you the stresses that are put through. I certainly see young people in my practice who fail one exam and they think their life is over because they failed that one exam. And there may even be some truth in it. My son has a colleague that has applied for medical school 5 times now. He's a teacher, and he wants to do medicine more than anybody else I've ever known. He's got decent grades, but not great grades. But those are undergrad from 10 years ago. And they are what are haunting him right now of not being able to get into medical school. First year calculus. What does that have to do with being a good doctor? Absolutely nothing. But there's a criteria that you need to meet in order for them to even look at the application. So, I mean, you think how competitive and how stressful that is. So certainly that is. We have all the environmental concerns of global warming. Do you guys at your age even have a planet that's going to be habitable by the time you reach adulthood? We have all the political stuff, which is, I hate talking about because I know I can't fix it, but crazy people running the most powerful countries in the world, threat of global nuclear war. I think all of those things factor into the increasing incidence of mental health. And I think so. If I could say, what is the one thing that is causing an increase in mental health issues? I think it's stress.
Yeah, definitely, especially given like what you just said with the condition of the world and everything. It's sort of just this general angst that I guess builds up
Yeah,
over time and accumulates, and
yeah,
it just really drags everyone down. And in
yeah,
addition to that, you get a lot of stressful activities and tasks that come from school, that come from this
yeah.
entire system that requires you to compete so heavily with other people to,
Hmm.
funnel into some sort of program that you want to get into the future. So it really adds to, these risks of developing mental health issues. I definitely agree there.
And being proactive, Matthew, saying how much mental health education do you get in your schooling or even unofficially in schooling? How do you manage stressors? I heard of a fascinating talk by a child psychiatrist from Montreal a few years ago, and somebody asked exactly that question. What can we do to improve good mental health in our younger people? And the psychiatrist said, we need to stress vaccinate our kids. Said, what do you mean stress vaccinate our kids? You have a puzzled look on your face. Everybody in the audience said, we are in a generation of helicopter parents. If there's a problem that is developed in your children, you helicopter in and you fix the problem for them. Somebody's bullying them, the teacher has, not treated them fairly in an exam. The parents comes and intervenes so the child doesn't have to. Said worse than that, she used the term bulldozer parents. Said not only do you wait till a problem happens, but parents come in and they bulldoze the way for their children so that they don't have ever any situation where they come into stressful situations. So if you do all of that, your kids are not stress vaccinated. They've never been stressed. They don't know how to deal with stressors. And then when a real stress comes up, they don't have the tools to deal with it. So, use what would be a simple example, bullying in school. When I grew up being an old guy now, if you got into a fight on the school ground because somebody is bullying you, well, you figured your way out of it. You didn't go home to your mom and you didn't go to the teacher. You figured it out. So when you get into the workplace, when you're finally at work and there's a coworker that is a bully, you had the mechanism to say, I know how to handle this. I grew up with this. And kids these days do not, have those skills. So her advice was, even if your children have such wonderful lives that they never have to deal with stressors, create some for them, create some stress and then teach them how to resolve those stressors because they will have bad bosses. They will have bad friends. They will have bad partners when they grow up and they need to develop those skills. So I think one of the things we could do going forward is to have a program to teach our kids. Yeah, this is how you handle stress situations, not insulate them from all the stressors.
Yeah, yeah,
Yeah,
definitely.
I
So hear that, parents. Make sure you back off a little bit and give
Back off.
more room.
Yeah,
Yeah, because I think it's so important to learn how to overcome stress or deal with it in a controlled, regulated environment when
yeah.
you're younger, rather than in an unregulated adult environment in the future.
But
So,
parents perceive what a bad world, what a stressful world
exactly.
it is, and they try to insulate us against those things. When
Yes.
my son was younger, I remember one day when he was, 3 years old, he didn't want to put on his shoes to go outside, and it was cold and it was rainy. And of course, as a parent, you say, put on your shoes. If you don't, your feet are going to get cold. Big fight about it. Then I realized, hang on, it's not my feet that are going to get cold if he wants to go outside without shoes on. So let him go outside without shoes on. And he went out and walked 10 steps and then came back in and put his shoes on. So we can't insulate our kids. We almost have to create adversarial positions from a mental health perspective, in order to be able to teach them how to manage those stressors in life.
Yeah, I totally agree. In our ever-changing world, there are so many external factors that we can't control
Yeah.
that eventually just lead to poor mental health. Would you say that there are cures for mental health problems, or can it only be treated?
Um, I think there are mental health issues that are transient, so I see many people that, for example, they're in a bad job with a bad boss, a bad coworker, they're depressed, they're anxious, and through multiple mechanisms that gets resolved. Now they're in their dream job with people they like, with a great boss, and their depression, their anxiety no longer is present. So we call those adjustment disorder with depression, adjustment disorder with anxiety. In other words, they're situational, they're transient. And then there are people with true mental health issues where the world should be perfect and they feel depressed and they feel anxious despite that. So I think it's mental health disorders, depression, anxiety. Many of the other ones are not one condition. It's a basket of conditions. There are people that have gone down the path inadvertently of alcohol or substance use. Once they get off the substances, their mental health issues resolve. So I think, like many things in medicine, there's no one diagnosis and one treatment that fits everybody.
Yeah,
Yeah,
exactly.
definitely. And just like substances can harm mental health, I'm wondering how can social media do a same thing? Because I think social media is sort of like framed as like a new drug for especially like teenagers and young people.
Mm,
And I'm
mm.
wondering, from your experience, how have you seen social media affect the mental health of your patients?
That's a great question. Social media dependency on devices is so prevalent. It is rare for me to walk into an examining room and see a patient without an iPhone. Doesn't matter how old they are, they're glued to their iPhones. And the content that is produced on social media is meant to stimulate. And the people that do this, they want you addicted to their product. So it's called a dopamine, fix. And I think people truly are addicted to that dopamine fix. TikTok being a good example of that. Every 5 seconds, a new video goes on, and and it feeds that constant dopamine fix, and that's why people they can't put down their phone, they can't lock it away in a drawer for a day. And I know this is with nieces and nephews. When we have family gatherings, we have to say deposit your cell phone at the front door. One person's going to keep a cell phone to take pictures to record it, and it's extremely stressful. You can see the anxiety when they're separated from their cell phone. So I think that's part of it. Social media is extremely powerful in terms of the addiction. It's it's what it causes that robs you from personal social interaction. There's a whole generation of people that don't interact face to face anymore, and I think that's the real harm. Whole generation of people that don't go outside to do exercise. Video games is their source of exercise. And then the other thing that I see from harmful media and people is that when they go on things like Facebook, everybody posts the best parts of their life. Here's Matthew on vacation in Hawaii, learning how to body surf. And here's Jonathan skiing up at Whistler, and his new ski instructor. Nobody posts all the bad stuff. So if you start surfing all of your friends, you kind of go, my life is crap compared to these people. And it's very easy to compare and become dissatisfied with life. And I think that's instrumental in causing unhappiness in life or competition in life that I think is destructive. So social media, to answer your question, I think is exceedingly powerful, but we have to be on guard that the potential harm that it can do, but also the potential education that it can produce to making people recognize the importance of mental health, the importance of self-help groups, apps like Be Calm, apps like that where they can teach themselves cognitive behavioral therapy, mindfulness therapy. And so I think it's a double-edged sword, extremely powerful to the positive as well as the negative.
On the topic of social media, I recently heard about a study published about how stuff like TikTok and Instagram Reels, like they give you huge dopamine spikes. And
Mhm.
from a biological perspective, they say that it damages parts of the brain. Like there's a term that Gen Z people call brain rot.
Yeah.
But if from a medical perspective, it actually does some harm to the brain. Could you explain how that works?
I think it works on neurotransmitters and down regulation of receptors. And this not only is social media addiction, but all other types of addiction. So the basis of addiction is that you feed your brain receptors a little bit of something, and you say, boy, that really feels good. That's the one of the main functions of dopamine in the brain. It's the feel good hormone. And then after a little while, you kind of go, I'm not getting the same buzz anymore from that. I need a little bit more of that. The one TikTok video doesn't do it. I need to see two and I need to see three. And so there's down regulation of those receptors. So it's demanding more and more of that dopamine fix in order to feel good. So I think that that's the rudimentary biological understanding of what happens in addiction, including dopamine addiction. So without realizing it, it can first come in just, yeah, I got a few minutes, it's a entertainment, it's a little bit of a time waster, it's a little bit of a downtime, but pretty soon you realize you need that dopamine fix in order to feel good, in order to function. Without it, you feel depressed and anxious.
Yeah, um, I am curious as to how maybe the social perception of depression might differ from the lived experience of a person who is suffering from depression. Have you noticed
Mm.
anything like patients have told you regarding depression, compared to maybe what society and what the media has framed depression as?
Hmm. I think there's better understanding that this is a biochemical condition attenuated by social and environmental factors, that there is a biochemical basis to it. So I think about it like diabetes. There's a biochemical basis to it. Either you're not producing enough insulin or the cells in your body are not sensitive to that insulin that is produced. That's the biochemical basis for depression. If you don't exercise, you don't burn off the calories. So you're going to get obese, and that's going to be instrumental in causing blood sugars to go up further. If you eat a diet that is high in glycemic index foods, that is going to increase your blood sugar. So I think society more and more is starting to understand that depression is very much like these other chronic illnesses. There's a biochemical basis to it. And I think that's a very, very positive thing because the medications that are available now can be very, very powerful. They can be targeted therapies to say the symptoms you have are a constellation of symptoms where we think it's a dopamine problem, or we think that it's a norepinephrine problem, or we think it's a serotonin problem. And now we're just on the cusp of being able to do genetic markers in people to say, your genetic markers, your DNA tell us that you're more likely to respond to this medication versus another one. So that would be a first good step. Right now, we use family history of it. So if you have a first degree relative, second degree relative that responded specifically to one category of medication, that's often what we go with as a starting point for treatment because likely, or there's an increased chance that you may have that same biochemical imbalance. So I think that's a big step forward. I think there still is some perception that medicines are a weakness, a cheater's way to treat depression. That I'm man enough, I'm strong enough, I'm woman enough to be able to handle stressors. I don't need medications, but I think hopefully that will slowly start to fade away.
I was wondering about existing treatments for like depression right now, because the thing is, like, I know the healthcare system, especially in Canada, is very overburdened. We have a lack of doctors and family practitioners and family doctors, and so are a lot of people suffering from depression maybe avoiding seeing the doctor because they think it's not worth it?
Yeah, yeah. And I think that very much is true, not only for mental health, but for a lot of other ailments. We have millions of people in British Columbia with no family doctor. And COVID kind of brought it to a crisis, saying everybody needs a family doctor. Everybody needs a quarterback for the team that looks at things globally. So when you go to a cardiologist, he looks at the heart. And that's what he's trained to look at. And the vast majority of the time, they do it very well, But how about all the other stuff? So if you have an anxiety disorder, a panic disorder, it can make your heart do flip-flops. It can give you chest pain. It can give you palpitations. Cardiology is not trained to look at that part of it. And that's where family medicine, it was highlighted that we really need somebody that takes a global look at the patient. So that's why there's this tremendous outcry. We don't have enough family doctors. They're opening up a new medical school, I understand, at Simon Fraser University in Vancouver, just for training family doctors. The family practice enrollment for family doctors now is full every year in medical school, from what I understand. I mean, it was in my lifetime when people, if they couldn't get into a specialty, they would do family medicine. Now it's exactly kind of the opposite. People are choosing family medicine because the demand is so high for family doctors. You can hang up a shingle anywhere. They've changed the fee structure so that family doctors are better compensated for the work that they do. So they consider family doctors specialists in family medical care now, rather than saying, you're just a family doctor. I mean, I have been doing this for over 35 years now, Matthew, and I've never enjoyed my job more. And part of it is the perception that patients have of what I do. When I first started practice, yeah, you're a doctor in Victoria. What do you do? Oh, I do family. Oh, you're just a GP. Now it's, oh my God, you're a GP. Can I shake your hand? Can I touch you? And the next question always, are you taking new patients? So the hierarchy of is changed completely within the medical establishment. It makes my job much more enjoyable, but more stressful because so many people are looking for family doctors and not enough available to take them.
Mhm. Absolutely. We did get one last Q&A question here.
Mm.
It says, is it true that after tens of minutes surfing on social media such as TikTok and Instagram, it, does it actually take another 2 or 3 hours for youth especially to get back to focus or to, be able to fall asleep?
It's a great question. Attention deficit disorder is one of the attention deficit disorder in adults is becoming a very, very popular diagnosis. So these are people that we know what happens in kids. They can't focus attention. Their brain is scatterbrain all over the place. They can't sit still, always getting in trouble with the teacher. So we knew about childhood attention deficit disorder, but more and more it's been recognized as happening in adults, people that can't focus. And one of the things I've thought about and I don't have the answer to, and I've not been able to get an answer from very smart people is social media actually creating attention deficit disorder in adults? Because it used to be you sit down with a book and it would take you hours to read the book. You focused on it. Or if you watched a movie, it would be a couple of hours to watch that movie. Now we get snippets of information to our brain every 5 to 10 seconds. And does our brain become dependent on that type of thing that basically is not attention focusing, it's attention distracting. And so I think I don't think anybody really knows the answer for sure, but I would bet there probably is a correlation that if all day long you're fed snippets of stuff that only in microseconds, that it does have some effect on the brain in terms of being able to settle down and saying, now I'm going to sit down and focus on one thing for an hour rather than focusing on something for 5 to 10 seconds.
Yeah, and I really resonate with that. Like the past 3 days, I've been
Mm,
putting my phone aside. I've been not spending time on social media at all, and I've clearly noticed my focus levels have increased so
really?
drastically. So, I think that's good advice for all young people who are currently suffering from the dopamine spikes from their Instagram and Facebook and TikTok
Yeah.
and everything. Um, we did just have one final question to conclude the webinar with. Um, we were curious, what is one piece of advice you would give to someone suffering silently from depression?
Mm. Um, I think to seek out the resources that can make you feel and function better. It's not a shameful thing. It's difficult to reach out and get help. It's difficult for friends and family, coworkers, colleagues to understand. If you have a broken arm and you have it in a cast, people come up and say, "Oh my God, you poor thing, what happened to your arm?" People with mental health disorders suffer in silence. You could be emotionally dying inside and nobody's going to know. Uh, and people with all good intentions sometimes, give you wrong advice. Oh yeah, you're just feeling blue. Come on and have a drink. You'll feel better. Giving bad advice to that. So I think the best advice for anybody is, first of all, I think be proactive. Identify the stressors in your life. Build up, inoculate yourself with stress immunization, so that even if it's shadow boxing, even if it's not real situations, say, if I was in this situation, how would I handle it? Because I know it's coming my way. And then the foundations of regular physical exercise, good diet, regular sleep, avoiding excess alcohol, avoiding mind-altering substances, all of those things are very, very helpful. Good communication, talking to therapists, talking to counselors. Psychologists are expensive. They're not covered by the BC Medical Plan, which I think is a real shame. But there are resources within every community of free mental health resources. You can sign up for many group programs like Be Calm, like Bounce Back, where you can get group therapy if you're suffering from depression and anxiety disorders.
Yes, Dr. Chow, thank you so much for that. Before we wrap up for today, any last words of wisdom you'd like to share with the audience?
I think the last words of wisdom are what I have been able to witness in you and Matthew, Jonathan. Be leaders for what you do. I was so impressed when I met you at the Family Medicine Conference. I thought this is youth that we can be proud of in the human race, that want to make the world a better place. You have your work cut out for you, but with the intelligence, the intuition, the motivation, the drive, I have no doubt that you have a good chance of making this a better world for everybody.
Thank you so much for your kind words. Everyone, this is Youth Advocates for Global Health Association, a nonprofit organization aiming for global health equity. My name is Jonathan, and I'm joined today by Dr. Chow. Thank you, everyone, so much for your participation. And Dr. Chow, thank you once again so much for your time today.
My pleasure to take part. Thank you, Jonathan. Thank you, Matthew.